No, thank you for putting this all together and for setting up this webinar platform. I think this is a great way for us to really be able to communicate. So I think maybe I'll introduce myself a little bit and then have Doreen do the same, and then maybe we'll take off from there since her and I are going to kind of pass the torch midway through and then bring it all back together at the end for questions and hopefully a mock legislative meeting. If anybody's having trouble hearing me, just let me know. You can type a question in the box or something, and I'll try to change my volume as needed. So I'm currently the chairperson of the Legislative and Payment Committee for the New York PT Association. I've held this position since 2014, so this is my third or fourth legislative cycle since chairing the committee. And previous to that, for a couple of years, I was on the committee as a member, and for several years before that, I was attending Lobby Day and just doing my part in the advocacy arena. So I think maybe I'll turn it over to Doreen just for a minute to introduce herself, so she has a very deep history of acting on behalf of our profession legislatively.
Well, thank you for joining us, everyone. I became a legislative liaison 30 years ago. It was 1987 when we first moved here to Albany, and I first acted as liaison, and then I was recruited thanks to Sue Bennett, who was president at the time, who works with Jake now. She recruited me to be a co-chair of the legislative committee. And I learned so much from so many of the NYPTA leaders, and then I got to teach to a lot of the legislative liaisons that served with me along the way. I've met so many students and PTs and PTAs from across the state that I've gotten far more out of it than I think I've given. But it became a passion trying to pass the direct access law, and so many people connected with their legislators that even though it took 25 years, it still was a miracle that it became law in New York. So I've come off of the committee and was advisor for a little bit, and now I'm back to being liaison for Eastern District. So I'm eager to get more new faces and get the enthusiasm to come over to Lobby Day or to make district. We're spoiled because being in the capital region, if we're in the closer towns to the capital, I can even go with people to their district meetings if they would like. So the whole purpose of this is to try and get people comfortable enough to meet our legislators and educate them. I'll turn it back to you, Jake.
Thank you very much. So I'm really hoping that this webinar platform goes well, because I think this would be an easy way for us to communicate similar information to different districts throughout the state pretty easily and in a more convenient way for most people to access. Before we jump into things, I just want to mention sort of our overall strategy legislatively over the last couple of years has kind of shifted toward building more long-term relationships with our legislators and trying to have more effective meetings as a result of these better relationships, kind of getting out there and meeting and being on friendly terms with these individuals who are representing us within the legislature. It seems to be a better approach than traditionally depending on Lobby Day as sort of our primary advocacy outreach endeavor. We trialed the local Lobby Days idea last year, and timing-wise it didn't go quite as well, or it didn't have as far-reaching impact as we were hoping, but it was still a good way for individuals to get into local legislative offices, one, without having to go all the way to Albany if they're not in the surrounding area, and two, at a time that was possibly more convenient for them and to sit down with their legislator in a little bit of a different setting than in Albany, where things are just a little bit more formal. And I've found personally sometimes these meetings can be even a little bit more helpful since you're catching the legislator in a more relaxed environment when you're trying to discuss sort of our priorities and ways that they may be able to help us and ways that our issues impact their constituents. So I think that some of the things that we'll talk about tonight are going to be very helpful for people who do participate in Lobby Day, but I think the message and the strategies go a little bit farther than that when trying to just have a better relationship with the individuals representing us, again, within the legislature. So let's get going. So the kind of the main takeaways for the evening, just hoping that by the time we get through the presentation, everybody understands the structure of New York State's governments and the process behind how a bill becomes a law within New York State. We'll go through some of the priority bills that we'll be discussing this legislative session and some history on them leading up to this year and how our strategy or plan may be changing for the 2017 session. We'll probably end up sort of changing gears at this point where Doreen will take over, and we'll talk a little bit more about how to conduct a successful local or even Albany-based lobby day meeting to educate legislators and make sure that as you're going through the meetings, they're as efficient as possible and help you craft the ask or what we're really looking for by the time that you get to the end of your meetings. And then one of the reasons why I was really excited to have Doreen participate with us tonight was to give everybody who's on the webinar an idea into a little bit of the history or specific information with some of the legislators, specifically in the Eastern District, since with there being so many, aside from a few key players, I don't have a great feel for all of the legislators. So this will be really a good opportunity to learn a little bit more about them. Just a quick outline. So I'll start with sort of the process and the calendar for New York State's legislative process, and then shift over to our priorities for the next couple of years and talk about a little bit of history, and then the updated language for the upcoming session or the current session. And then we'll switch over and Doreen will give some feedback on committee information, and then again about, like I was saying, preparing a good, effective meeting, and then discussing some of the legislators specifically in the Eastern District. And then we'll go through some questions, hopefully, and then if, depending how we're doing on time, we were planning to do a couple of mock meetings just so that everybody who's participating can understand sort of the flow of how these meetings tend to go. So for the legislative process in New York and really in general, it starts with bill drafting. So you have to have an idea first, and then that idea is written to create or to even amend a standing law. So in our case, if we have an idea for a bill, for example, maybe the title protection bill, where we're looking to protect the DPT title specific to physical therapy. So we have an idea saying that, you know, most of the states in the country have already done this, and we would like to do the same. So in our case, we have our lobbyist, who is an attorney who's trained in this kind of law, pull up the records of the current laws that apply to how do you protect professional designations, and then go through and draft the amendments or the changes that would be required in order to pull this off. And that's sort of the first step, is getting our own language crafted that we want to move forward with. And then from there, the bill has to be sponsored. So you have to find a member of the legislature, somebody in both the Assembly and in the Senate, who is willing to sort of be the steward of the bill and put their name on it and introduce it into the legislature in order to initiate its movement. So generally these individuals are chosen with some type of strategy where, depending on where the bill might be going once it's introduced, you might want somebody who has some pull in that direction. We'll kind of talk about how that might work. And then also depending on how the makeup of the legislature is versus which party has a dominant number of members, that kind of goes into play when it comes to considering who a sponsor might be for a bill. Once you do have a sponsor, the bill is then introduced. So the member who is sponsoring our bill would introduce it during a session of the Assembly or a session meeting of the Senate, and then it would be assigned a number, and then it's printed. And then from that point there, the bills are then referred to a committee. So depending on what the bill pertains to, that sort of will affect what committee is eventually referred to. So for example, that title protection bill, because it has to do with relation to an educational title or licensing designator, that would then be something under the purview of the Higher Education Committee. So that's where that bill was eventually set to. Our copay bill in the past has gone to the Insurance Committee. So all of the bills, again, are sent to a group of individuals who are members of committees that deal with specific items or specific types of items. So once your bill is sent to a committee, it will stay there until the person who is the chairperson of the committee chooses the bill to bring forward for a vote by the committee. So it's not possible, as far as we've seen, that I'm aware of, for a bill to get through to be voted on by the entire Assembly or the entire Senate without first working through the committees in each of those chambers. So once a bill is delivered to a committee, then we generally reach out to the members who are serving on these committees, and they can be legislators from across the state who are chosen to participate on these committees. And then we try and educate them about the bill that we have and why we think that it needs to move forward, and urge them to bring it to a vote at the committee level. Once the chair chooses the bills to be voted on, they come up for a vote, and as long as they make it through the committee, they're then reported out. And from there, they're sent to the full body of either the Assembly or the Senate, depending on where that was coming from. So if it was in the Assembly Higher Education Committee, once it passes committee, then it goes before the entire Assembly. And then the same would have to happen on the Senate side from there. So once a bill is delivered to the whole Senate or to the Assembly, it has to get through a floor vote. So once bills come out of the committee, they're added to a calendar for the individual chamber, and then the bills are they come up to a vote based on the order in which they're added to the calendar. So that once they do come up, then the entire chamber, whether it's the entire Assembly or the entire Senate, actually then votes on that bill. Once a bill is passed on one side, so let's say it makes its way through the Senate, then it has to still make its way through the Assembly, through the committee process, and through the General Assembly before it can then be delivered to the governor. So once a bill is passed by both chambers, it goes to the governor, and from that point there, he has 10 days to either sign it into law or to veto it. If it goes beyond the 10 working days and no action has happened, then it automatically becomes law. So this whole process is tied to a very specific calendar, and these things kind of happen in a cyclical matter, and each year the legislative cycle begins in January with the new year. And our state legislature runs in 2-year legislative sessions where you get a 2-year period where this year, for example, from January 4th was the first day of the 2017 session. The first year of that 2-year cycle will be the entire year of 2017, and then the second year of that cycle will be 2018. So every time that a new 2-year legislative cycle starts, all bills must be reintroduced and renumbered. So the bills that were in existence for 2016, they all go away completely. Anybody who's proposing them has the opportunity to change, make any changes they want to, select new sponsors, and then have them ready to be introduced at the start of the upcoming session. And then at the end of the first year of the cycle, the bills, they don't lose their number, they maintain their number, but then when the second year of the session starts, you have to get all of your co-sponsors and everything over again. I think that comes up again later in the presentation. In the beginning of the session each year in January, the budget is sort of what eats up a lot of time. It has to come first before we really see the legislator get to a lot of substantial policy and legislative movement. So each year the governor must submit a version of the budget, usually in mid-January. This year it was presented on January 17th. And then this has to be approved by March 31st by the Senate and the Assembly in order for the new fiscal year to start smoothly on April 1st. So again, early in the session, this really does consume a fair amount of time, which is why we never see lobby day or any significant legislative endeavors really before April, the beginning of April. So then once the budget is out of the way, that kind of opens up the floodgates, and it's a really busy time in Albany, especially for groups that are looking to push certain pieces of legislation. Lots of the lobbying activities occur from this time between April 1st and then whenever the last day of the session is. So usually it's at the middle to end of June for the last day of the actual legislative session to occur. So this year it's June 21st will be the last day. So any legislation that we're looking to have completed and passed through has to get through both the Senate and the Assembly by this June 21st deadline. So really there's a lot of work to be done in a pretty short period of time. From the time that the budget is finished by April 1st until June 22nd, I mean, that's not a substantial amount of time to try and acquire lots of co-sponsors, get a committee vote for a bill, get that bill then to the entire body, whether it's the Senate or the Assembly, and then through both sides in order to be eligible for the governor's signature by December 31st. So if you don't have your bill through the Senate and the Assembly by that time in June, then that bill is essentially dead until the start of the next legislative session the following January. So then again, like I was saying earlier, during that second year of the session, the bills will maintain their numbers, but they start over in the process as far as being referred back to their original committees and losing their co-sponsors, and then you have to get everybody to kind of re-up on those bills. Now that we have hopefully a better picture about the process and the timing and how these things all sort of fit into the calendar year, I wanted to go through some of our current legislative priorities that we will be introducing bills or already have introduced bills specifically to address over the next year, and then we'll talk about a few things that we don't have specific bills lined up to be submitted, but they are things that we're working toward that have to do with legislation. So we'll start with the insurance copay reform bill. We do have an Assembly version of this bill right now, and again, Assemblyperson Cahill will continue to be our sponsor for the 2017 session. We don't have a version yet that has been introduced on the Senate side, and all of these areas where there are blanks, we intend to have versions updated and sponsored and introduced before we get to lobby day, and really as soon as possible. So the previous copay bill that we had been floating around the legislature for several years had proposed a 20% copay limit. The thought behind this was it was sort of an easy round number that everybody could wrap their head around, and it was consistent with Medicare, which is the largest healthcare payer in America, and it was thought at the time that this would be sort of the most well-liked version of the bill for a while. In 2016, we did have a record number of co-sponsors on the bill, and just to sort of highlight what a co-sponsor is, when you have your bill initially introduced, it is sponsored by a single legislator, and then as you seek support from your individual legislators, they can sign their name onto it to indicate that they are supportive of the bill. So in theory, the more co-sponsors that your bill has, the more favorability you should have within the legislature, and the higher likelihood of it moving. So for 2016, we had 82 Assembly co-sponsors for our copay bill, which was more than half of the Assembly, which is a pretty impressive feat, considering that we had really very nice bipartisan support, and it's not easy to get more than half of that body to be on board with something that we're after. And then on the Senate side, we had 21 co-sponsors. So after going through sort of our strategy with the previous copay bill and meeting with Assemblyperson Cahill and some other relevant stakeholders with this bill, we've kind of been led to believe that maybe the 20% amount copay limit is not as favorable as what we kind of previously thought. So the goal is going to be in the future to try and make this copayment amount for a physical therapy visit equal to primary care services. And some of the more contemporary language that's out there within the insurance companies is this idea of an office visit. So if we can use language in the insurance law that ties the PT visit to the same amount as the amount for a copay for a primary care visit. It's much easier to understand, really, for the patients and for the providers out there, and it's easier for the insurance company to actually to implement. So instead of having to create a formula within all of their current algorithms and practices and the way that they're processing things, they can use, they can just plug us in essentially with the same category as the primary care providers that are out there. So in discussions with others, we've found that this is probably the best way to move forward and take advantage of all of the support that we had previously for meaningful copay reform and deliver it in a way that the remainder of the legislature and some of the other people who are kind of following this, they might be more easily persuaded with this type of language. A new area for legislation for this coming session has to do with referral for profit. So we've had a piece of legislation that we've kind of gone back and forth on introducing in the past, and we never really had the right sponsor and the right political dynamic to move forward with it. But we're thinking that in this time of fraud and abuse and trying to control for healthcare costs, that this might be a good time to highlight some of what's going on out there in the real practice world. So at this point, our lobbyist, Brian Lucy, is still working on specific language that we need to review and decide exactly how we want the language to be worded, and then find the appropriate sponsors. But the purpose essentially is to require better transparency of physician ownership in ancillary services. So in our case, physical therapy. We want it to be very clear when a patient is referred to a physician-owned or hospital-owned clinic that that individual has to acknowledge their financial ties to that organization while they're referring that individual for those services. And then the other thing that we're hoping for this bill to do is to restrict the practice of conditioning or referral for PT on where these services will eventually be performed. So not being able to say, you know, I'm not going to write you this prescription if you're going to go and see your own personal physical therapist that you've seen in the past. We're saying I'll send you for therapy, but it has to be done within our facility here. We have had some examples in the past of patients that were looking to go for therapy and had run into issues with this in the past, and we think now is a good time to introduce legislation to try and combat these practices. And then once we have this introduced and fully drafted, we'll be able to post on the NYPTA website and then offer out the appropriate talking points for when everybody is carrying out their meetings. Our title protection bill, again, we have a Senate version for 2017, but we're still waiting on an Assembly version. Our previous Assembly sponsor, Michelle Schimmel, she has actually left the Assembly. She did not run for re-election. So one of her last things was really trying to push very hard to get this bill through before she was at the end of her term, at the end of the last session. But unfortunately, we're not successful in doing that. The bill had passed the Senate in 2016 and 2015, I believe, but we could not get it through the Higher Education Committee in the Assembly. When this happens, when you get kind of roadblocked with a bill, the next step then is to try and figure out, you know, what do we need to do to either change this to make it something that everybody can agree to, or you know, what are the main obstacles to getting this through. So last year we were able to work very closely with the State Education Department and the Higher Education Committee on the Assembly side to try and figure out what some of the holdups were with this. And in doing that, we were able to come up with a late revision to the bill that eased some concerns presented by the State Education Department. And then after we had that finalized where all parties were kind of on board with it, we just ran out of time in the session. You know, we got to that mid to late June deadline, and the Higher Education Committee wasn't planning on meeting again for the session, so there was no opportunity to get a committee vote to then get it to the floor of the Assembly. So based on our success toward the end of last year with getting the right language that everybody had found to be satisfactory, we're going to lead with this same strategy for 2017 with the bill language and the same kind of plan of attack, and hope that it goes through more quickly instead of waiting until the very last minute of the second year of the session. And then the number one priority is getting an appropriate Assembly sponsor, and Brian is reaching out to the people that we kind of think would be the best fit for that. We went through the Assembly roster and narrowed down 2 or 3 people that we think would be a good sponsor, and he's working on reaching out to them and trying to get them on board currently. The workers' compensation, the PT assistant bill, this was kind of a heartbreaker at the end of last year. This was really a tremendous collaborative effort trying to get all the right pieces of the puzzle together for a final product. Unfortunately, the bill ended up being vetoed at the absolute last minute by Governor Cuomo in 2016. And what happens when a bill is vetoed is you get an announcement that is emailed to you that says your bill has been vetoed, essentially, without any initial explanation, and then within the next day or two, a memo is released that explains the rationale behind the veto. So we were optimistic that the governor would sign the bill into law, and then when that ended up not happening and he vetoed it, we thought, okay, well, we'll see what issues they had found after we thought we had ironed everything out, and we'll be prepared to change things for the next year to address that. When we received the veto message, it was extremely frustrating to see some of the points that were highlighted by the governor's office as far as reasons not for passing the bill. This idea that physical therapist assistants would provide care under the supervision of a PT instead of under a physician, creating this sort of inability for the provision of PT care to be governed appropriately is just not appropriate, and not the way that service delivery is managed at all in any environment. They stated that this would authorize treatment by a provider who is not subject to any state oversight, indicating that physical therapist assistants are not credentialed or certified or licensed in any way, which is not the case. All PT assistants have to pass a certification exam in order to maintain that and be able to practice in New York State. So that was not factually correct. And the memo also indicated that adding physical therapist assistants to appropriate providers under the workers' compensation system would drive up costs by requiring additional physical therapists. I don't actually even know where to start with that one. The physical therapists, the care of physical therapy by a physical therapist is already very well regulated by the medical treatment guidelines and existing workers' compensation guidelines. So it would be very difficult to drive up care when the system is already so tightly regulated. And this idea of requiring additional physical therapists to satisfy this, it just doesn't really fit with the intent of the bill or what we were looking to do. So then after we got through this and read this, the State Education Department actually reached out and acknowledged that some of the things that were listed in this veto memo were not accurate, and they had relayed this information to the governor's office, suggesting that their services for consultation may be helpful in the future. The State Ed Department acts as a resource for the governor's office and for the legislature when bills are moving, but the State Ed Department doesn't actually have any official authority when it comes to voting on bills or taking stances on them. So unfortunately, the State Ed Department couldn't really work on our behalf going through this process, but they have made it clear that they are a resource for information as this bill starts to move forward in the future. And then after, again, the veto, both of the sponsors who supported our bill in the past issued press releases to express their disappointment, and our chapter president did the same. So as far as what we're going to do with this bill for 2017, it has already been reintroduced in its previous form into the legislature, both the Assembly and the Senate. Our plan for the very near future is to initiate a meeting with the Workers' Compensation Board just to make sure that where we had left things after collaborating with them and the AFL-CIO, which is a major labor union, and the governor's office last session, I want to make sure that that work is still relevant and that everybody is still in agreement with what we were able to do to change the language and move it through both chambers of the legislature last year. And then moving forward, we're just going to continue to educate our legislators about why this needs to be changed and why it's relevant. And then especially to the governor's office, once we're able to get this through the Assembly and the Senate again. I think once the talking points are posted for this bill this year, they will highlight some of the inaccuracies contained in that veto message from 2016, which will give individuals meeting with their legislators some talking points as to, yes, we know that this passed both chambers last year and was vetoed by the governor, but we feel that that veto was not completely appropriate based on X, Y, and Z from the previous veto message, and we can cite relevant sources to make sure that everybody understands that they were not appropriate. So other areas that we are focusing on but don't necessarily have legislation drafted for include what you see listed here. This idea of insurance transparency and adequacy has to do with payers making it very clear both to providers and to beneficiaries what the patient responsibility is, what the actual amount of PT coverage is. We've been having issues where in one part of an explanation of benefits form it says one thing, but then when you get deeper into the policy book or document, you end up seeing something else which supersedes what's written previously, which is extremely confusing. We've had issues where in one area it says you're authorized or you're entitled to this much care, and then later on it backs that up by saying that it has to be after a post-surgical incident or a hospital admission, which kind of leads right into that next piece of adequacy. If your PT care, physical therapy is a mandated essential health benefit, but you're only able to access it after you've been hospitalized or undergone surgery, then our opinion is that that's not adequate physical therapy coverage based on the current insurance law that's out there. So our initial thought with this was bringing forward some legislation to try and correct it, and then we were able to work with some state agencies to get some traction in this area, and at this point we're going to continue to pursue that and then really kind of only bring legislation forward if absolutely necessary, just because of the uphill battle that these kinds of things tend to be once you try and do something legislatively. We might be able to get it done much more quickly and smoothly if we're able to find non-legislative means. The state budget, so again, we have until the end of March until this is finalized. As changes and amendments are made to the budget, they are monitored by the firm that provides our lobbying services to ensure that there aren't any items within the budget that have a negative effect on rehab or physical therapy, and then we can voice our concerns as we need to. And then the ever-going battle of monitoring what some of the other professions are doing as far as things they might be looking to accomplish legislatively over the next couple of years, and how that may conflict with what we're looking to do or with how PT care is delivered in New York State. So the biggest thing that we've seen with that in the last couple of years is what we've been working with the athletic trainers, trying to get to a point where we can get them successfully licensed, but with language in the Practice Act that is appropriate for really where they're at education-wise and skill-wise. So as we get a little further along with these things, any updates will be posted to the website under nypta.org/legislation for any updates as they become, if they come through. So I think at this point here, we've got a little bit of a background on the bills that we're moving with for this session, and a little bit about how the whole process works. So now I'm going to turn it over to Doreen so that she can help us get us ready for a meeting and craft our ask and have a little bit of a background on what your individual legislators might have in store for you.
So Jake, do I use my PowerPoint on, or are we still going to be using yours?
I think it would probably be easier to use yours so you can change the slides on your own command. Unless you'd rather have me do it, you can just give me the cue.
Okay, and so
I would
if
take
I'm
myself off of presenter, I think.
Yes, just make Doreen a presenter.
Okay.
Do you want me to do it, Jake, or you got it?
Why don't you go ahead and do
Okay,
it
I'm going to
for
make,
you?
yep. Doreen, I'm making you a presenter.
Okay.
So you just now need
And,
to, you need to share your screen.
okay, and so now I thought I had it on the slideshow. Oh, there we go.
Yeah.
Is that okay?
Yep. Perfect.
Okay. So the first thing that is a big help for anyone who's going to meet with a legislator or even who just wants to write a letter to a legislator is that the NYPTA's website has so much information on it that is one of the best resources. So you can go to the nypta.org legislation pages and you'll see how it's well organized and might need to be updated, but some of the same issues from last year will be the same. So you can begin to get a little bit of knowledge from that. As far as getting to know your legislator, the assembly members and the senators' websites have concise biography. Some people in our Eastern District already know their assembly member or senator well. If you don't know them from other things in your community, it's good to just take a peek. You definitely have to know if they're a Democrat or Republican. You should know if they're a committee chair, because those committee chairs all are on the Rules Committee, and some of our bills will have to go through the Rules Committee. So it's good to know a little bit about your member. It's even nice to know, maybe they went to the same college as you, and that'll be an icebreaker. It might be that you went to school with their grandchild. Some of them are so old they've been in the Senate forever. So you can familiarize yourself a little bit with them. Maybe you see them at Little League parades or at school functions and you already have a relationship with them. If you don't and you see, oh, I see they came to the Kiwanis meeting, that's a way to try and be friendly with them, saying, oh, I see you attend a lot of the fundraisers for Kiwanis. I'm very interested in that group as well. Whatever. It has things on their bio there. If you don't know who your person is, then I put in here the link to try and go on and find out who your person is. Some people mistakenly will put on the Lobby Day registration form Senator Schumer and Senator Gillibrand. Well, there are U.S. senators, so don't get that confused. And your Congress member in our area, it might be Paul Tonko. He's a House of Representatives for our district, and he's not our assembly member. So we've got the 60 or 62 senators for New York State, but we only have 2 United States senators. But the APTA, I'll put a plug in for the APTA website as well. They are very organized too, with all of the letters being easy to send to the 2 senators and your Congress member. So please take the time to look at those. You're going to look to see if your member is on the insurance committee, because that's where our copay bill is going to go. If it's the workers' comp and the PT assistant bill, it's going to go to labor. And if it's the DPT bill, it's going to go to higher education committee. So those people who are on there have the first vote, and they can be powerful in asking the chair to move the bill. So you'll see when you come for Lobby Day, I'll have it all organized who belongs to which committee. Okay, for our Eastern District, Kathleen Marchione, who was a hard nut to crack in the beginning, she has finally signed on to the copay and the workers' comp bill. She used to be on the Labor Committee, and that's why we were trying to get her to co-sponsor the workers' comp bill. She's no longer on the Labor Committee, but she is a co-sponsor. She has had a bit of a experience now with physical therapy because she had, I think it was bilateral hip replacements. She wasn't able to meet in the district last year because she was in recovery. But she represents parts of Rensselaer and Saratoga, Washington counties, and all of Columbia County. So that's going to be people from all, she has a long way to drive when she has to visit everybody. So we're going to ask her to co-sponsor, we don't have to ask her to co-sponsor copay anymore because she already, no, I'll have to check if she added herself this year or not. But we'll have that finalized. For Neil Breslin, he was actually one of the main sponsors of our copay bill years ago when the Democrats had the majority in the Senate. He's a longtime friend for physical therapy. He covers all of Albany County and a part of Rensselaer County. He is definitely influential, even though he's not in the majority in the Senate. He can certainly help us, and he always holds a friendly meeting with us. We're going to ask him to be sure to sign on to the copay bill, and he is on higher ed and the insurance committees. Elizabeth Little never co-sponsors anything. We ask her year after year. She's friendly in the meetings. She's a Republican, and she's also got a large chunk of the upper part of Eastern District. She's got Clinton, Essex, you see Franklin, Warren, and parts of St. Lawrence and Washington counties. Several of the therapists up in the Plattsburgh area did a local visit with her 2 years in a row. They have a hard time coming down to Albany, but she met with them in her Plattsburgh office. And every year somebody meets with her. She's very cordial, but she just says she doesn't like to sign on to a bill because then it might be amended and she might not have agreed with the amendment. So we just get her to be sure she's going to vote with us. George Amador was a senator, then he lost his campaign, and now he rerun the seat. He also, in the beginning when he first became a senator, didn't really meet with us. And then after he lost, I think he realized, I better start meeting with constituents. And so he did meet directly with his constituents, and he became a co-sponsor of the copay bill and the workers' comp. So we're going to ask him to sign on again for copay and the DPT bill. James Tedisco was an assembly member for many, many, many years, and he won Hugh Farley's Senate seat. So he's got parts of Saratoga and Schenectady and Herkimer counties, Fulton, Hamilton. First term as a Senate, he's now in the majority. He was in the minority in the assembly, now he's in the majority. He last year visited a physical therapy clinic in his district. He went to Physical Therapy Associates of Schenectady in Scotia. He has been a recipient of physical therapy. He's always been a friend to us, so now we've got to get him to get on to the Senate bills. He did finally, after many, many years, he was never listed as a co-sponsor for our copay bill, but after he visited Tom's clinic, he signed on. So we're happy for that. We also have James Seward. Mostly the Ithaca people will visit him, but he does cover part of Schoharie County, and so that includes some Eastern District people. I would love people, if they knew any therapists in Cobleskill or that area of Schoharie, that we get somebody to visit him along with the Ithaca people, because he's very powerful. He chairs the insurance committee, so the copay bill is going to be referred. He's the one that decides whether or not it comes up for a vote. So we really have to get him on our side. He was very, very instrumental in, there was a vote for when the chiropractors were trying to prohibit physical therapists from performing manipulation. We had so many senators say, of course, they would never allow physical therapists to be prohibited from that. Well, that year, there were many chiropractors and lobbyists who were very close to Governor Pataki, and he did a message of necessity, which means in the middle of the night, he put forth the chiropractor's bill, and only one senator voted against it, and it was James Seward, because of the Ithaca PTs that visited him. He was the only one paying attention. So it really does pay to have that long-standing relationship. in our Eastern District, we have several very, very friendly assembly members, so we're very lucky. I always feel bad for the districts whose representatives are sort of argumentative and confrontational when they're discussing bills. Our meetings are always very congenial, so that helps a great deal. Peter Lopez has got parts of Albany and Columbia County and all of Schoharie County, and you'll see he's a co-sponsor of the copay and workers' comp, so we're going to thank him for doing that, and we're going to request he add his name to the DPT and when we get the referral for profit bill. Steve McLaughlin, you might hear if you see interviews on TV or talk radio. He loves to make fun of Governor Cuomo. He is already co-sponsored our copay and workers' comp bills. His office called me yesterday. I'm not quite sure. They wanted a list of all of the private practices in the area. He had a constituent, I guess, who was upset because their doctor told them they had to go to a hospital PT. And so I sent him a list of all the private practices, and I'm not sure. I said, is there something we can help you with beyond that? The secretary said, no, just send us that list. So I think he'll be pleased to add his name onto the other bills. Another friendly guy is John McDonald. He's also a pharmacist, so he understands health care, and he has been past sponsors. He sits on Higher Education Committee, so that would be, we'll ask him to urge the chair to again pass the DPT bill, which we already passed. Oh no, it didn't pass in the Assembly, it passed in the Senate, excuse me. Patricia Fahey, in her beginning of her term, she also didn't sign on to things, but we persisted, and we had people from the Delmar area and Albany visiting with her, and so she has since understood what's going on with physical therapy and the bills, and she became a co-sponsor of copay bill, and she's on again. So we'll get her to see if she'll put her name on the other bills. Phil Steck's brother is a physical therapist, and he also in the beginning wasn't putting his name on the bills, but again, we just kept finding constituents that were from his area. His district has changed. Now it includes more of Schenectady and Niskayuna, but he was always Loudonville, Latham, other parts of Albany. So his aide has been the same man that's met with his constituents for several years. I don't think he's ever met the constituents himself. He always seems to be at different places when we have lobby day, but his aide does all the work for us, so that's easy. Angelo Santa Barbara, I see Tracy Sawyer's on the line. She's met with him before, and he's also been very receptive to physical therapy, so we're going to ask him to make sure he gets his name on the other bills besides the co-sponsor bill. Mary Beth Walsh is brand new. She's a Republican who replaced Assemblyman Jim Tedisco. I think she had a good relationship with Jim Tedisco. I'm going to try and find that out for sure, and we'll ask her to sign on to all the bills. So that meeting might be a little bit more on educating her what the bills are. And Carrie Werner, she's been wonderful too. I keep saying that word, wonderful. We're very spoiled. She's a Democrat who covers parts of Saratoga County and Washington County, and she put her name on the bills. Thanks to her, and we'll request that she add on to the DPT bill. Dan Steck is a Republican. He has all of Warren County and parts of the 3 other counties you see there, Saratoga, Essex, and Washington. He also has been easy to talk with. We'll ask him to add his name to the other bills. He's only on the high copay bill. We can thank him because he voted yes for the workers' comp bill. Another new person is Billy Jones. I was trying to find out a little bit about him, and so I went to the bio. And he's going to replace Assemblywoman Janet Dupre. She also had a physical therapist relative, and the Lake Placid people and Plattsburgh people, they met with Janet up in her home district because, as I mentioned, they don't seem to come down for lobby day. But she has always, even when she didn't have her constituents with her, I think I got a call one year that said, we didn't get an appointment with the physical therapist. can someone come see her? So I thought that was great. We were always sure to make sure we visited, even though we didn't have a constituent. So this guy, Billy, was a corrections officer, and he's a big farmer, so we're going to educate him on things and ask him to co-sponsor the bills. I'll try and get people to do the home district visits there. So as far as the preparing for the meeting, the website is going to have talking points from the past years, and then prior to Lobby Day, or if you're going to do a local meeting before Lobby Day, please contact me or the chapter office, because we'll provide you with written material. Everybody's going to have a packet to bring to their legislator, and the attendees will download the information for their own packet. Here in the fair co-payment, then, our co-sponsors were Senators George Amador, Kathy Marchione, and Neil Breslin. So Jim Tedisco was an Assembly sponsor, and we're going to make sure he realizes his name yet isn't on the Senate bill. In 2017, the Assembly members for co-sponsors are all listed there. I think everybody is a co-sponsor. I don't think we're missing anybody except the 2 new ones. So we're going to try and give them real-life examples of how every week therapists are receiving patients in their clinics, and the patient sometimes will say, I can't afford to come because my copay is $60. And we're going to explain that, in fact, sometimes the contractor, the provider contract that we have, we're getting reimbursed less than $60. So the patient's copay is higher than what the provider receives in reimbursement. We're given the stories how physical therapy is cost effective. We're the ones that help to return people to function, yet these insurance companies have shifted the burden to patients. If a patient has a catastrophic diagnosis and they have had a brain injury or a CVA, or they need both physical and occupational therapy and speech therapy, that's impossible for someone to pay for treatment 3 times a week for 3 services. We'll explain that our association has repeatedly met with several of the large health insurance companies whose representatives sit across the table from us and agree that this is crazy. It's ridiculous to expect a copay to be so high, yet nobody has changed it. We've given them examples of how other states have changed the law and mandated that a copay not be excessively high. We're not going to use the 20% anymore, but one of the examples was Connecticut had changed their law to 20% of the amount, the approved amount. So we'll just explain that by having such high copays, it leads to more costs. And you can just give everyday examples of how your patients, I mean, one of the ones I use is that a cashier at the supermarket has MVP and her copay is $40 and MVP pays me $42. So MVP pays $2 and the patient pays $40. That's one of the examples. You can point out how some of the insurance companies require physical therapy prior to an MRI, but the patient can't afford the physical therapy because the copay is so high. Of course, naturally, we will use the opioid overdoses and the excessive prescription medications. And the Lobby Day will have summaries of the studies showing the cost savings with affordable copay. This is the Assembly copay bill for the 2017, all of the sponsors, where Jake mentioned that we had as many as, did you say 82, I think it was? So it's wonderful to see bipartisan support. In some of the years that I was so active, the politics in Albany was so bad that the bills were no longer bipartisan. The Assembly bills were all Democrats and the Senate bills were all Republicans, and they wouldn't let somebody co-sponsor. The main person to help fight for us for the copay bill in the Senate in 2016 was Senator DeFrancisco. Here I just highlighted that Neil Breslin was our main sponsor in Eastern, and that took a lot of bravery because he was chair of the Insurance Committee, and of course the insurance is lobbying against this bill. So we got to recruit Senator Jim Tedisco. That's our main message for Eastern. In the Assembly Insurance Committee, these are the people that sit on the Assembly Insurance Committee. And we have Phil Steck and Mark Butler. Mark Butler actually, I think they redistricted, and I'm not sure he has any part of Eastern District anymore, but Tracy Sawyer has met with him every year because it's hard to find a constituent, and she worked in his district doing some home care, so they have a good relationship. And there's our Senate Insurance Committee with Neil Breslin on it. As far as updating the workers' comp ground rules, Jake spelled it out that we're just going to have to explain that there were alternative facts in that veto message, that it was unsubstantiated. It really, this will be spelled out. The fact that the PTA is under Office of Professions supervision, and they're under the supervision of a physical therapist, and there would be no increase in cost. So I don't think there'll be a whole lot of time spent on that. Just as physician's assistants are an extension of the physician, so too the PTA should be permitted to assist the physical therapist. So in 2017, we've got Lopez, McDonald, McLaughlin, and Werner. So if that's one of yours, it's going to be easy because you're going to thank them for sponsoring that, and we're going to ask them if there's anything they can do to move the bill along, that we would appreciate them asking the chair of labor to move the bill along. This is co-sponsors. We have Amador already, Breslin, and Marchione, so we need to ask Tedisco and Little to add their names on. And here's the Labor Committee. The chair is Michelle Titus, and in Eastern we have Phil Steck. So anyone who has Assemblyman Steck is going to ask him to please ask Assemblywoman Titus to put the bill on the agenda. In Senate Labor, she's also a new committee chair, Marisol Alcantara, so we're going to have to get lots of greater New York people who will be in her district to ask her to move the bill along. We don't have anybody. Used to be Senator Marchione was on Labor Committee, but she switched committees. She moved up to, I guess, the committee she wanted. When you first get elected, you don't always get the committees you want. This was a bill that we had back in 2011, 2012. So many people still ask me, what are we going to do about the workers' comp and no-fault rate? We haven't had a raise since 1996. Well, this was the last time this bill was introduced because Workers' Comp Board said they were going to do a reform of their program, and it looked like we were going to get an increased fee. We did not, but the physicians did. They changed all of the guidelines, and the bad thing about it was we did not get a fee increase. Our bill was to try and get them mandated to at least meet with us. In the old days, Workers' Comp had a medical advisory committee, and physical therapy sat on that committee. In 1996, one of the doctors said, when can we put on the agenda a fee increase? And then they abandoned the medical advisory committee. Nobody was ever invited back, so they didn't have to address it. So we thought if we put in legislatively that they had to meet with us, then we could at least get an audience. Since then, we've had many different meetings with the presidents of NYPTA and the lobbyist and Workers' Comp, but I don't know where that stands presently. I just wanted to point out that the NYPTA was trying to get that fee increased. It certainly didn't reflect the cost of doing business not to have a fee increase in, was it 20 years or 19 years? The DPT bill, Jake already explained as far as protection of the term, and the Senate sponsor, Kenneth Laval, has been a longtime friend. He has a lot of PTs on Long Island that stay in touch with him. So he chairs the Senate Higher Ed Committee, so he's the one to move the bill there. And Deborah Glick from New York. I mentioned the chair because sometimes your legislator will say to you, well, what does Assemblywoman Glick think of this? And sometimes you won't know the answer to that question, and you'll say, I will have to check on that and get back to you. And then you make sure that you write that on your summary form, and then we'll get back to the legislator and let them know. If they're a friend of Deborah Glick's, maybe they could be a help for us. In Eastern District, we have Mark Butler, Pat Fahey, and John McDonald on the Assembly Higher Education Committee, so they can help get the DPT bill through. And then Neil Breslin and James Seward are on the Senate Higher Education Committee. I'll have these in a summary for you for Lobby Day. Jake last year had all of the legislative liaisons have a big cheat sheet for their district telling them who was on what committee and what was going on. Several therapists often ask me about the early intervention cuts and the corporate practice of the profession for purposes of EI. So again, if that comes up as the session moves along, there'll be talking points about it. But certainly, again, the stories about infants and toddlers who might not be able to get services because they were trying to move the services to commercial health insurance and not the counties and state paying for services. You would just give patients stories about that. And the purpose of corporations coming into New York, we're still opposed to that, because if a business owner owns a practice and a practice is doing something wrong, the business owner isn't punished. The professional has to have sanctions from Office for Professions, and that's why New York State opposes corporate practice in physical therapy. You should also know that your legislator might ask, who are your lobbyists? Nobody's come to visit me. Our lobbyists are wonderful. Sometimes legislators insult lobbyists, saying, well, nobody's come to speak to me. They do prioritize who their visits have to be, but the firm is Whiteman, Osterman, and Hanna, and the lobbyists are Brian Lucy primarily and Rich Leckerling. And then Majority Senate Leader is John Flanagan from Long Island. Longtime friend to physical therapy. His father was his predecessor in that district, and the father was a good friend to physical therapy too. Marilyn Moffitt and her Greater New York people back 35 years ago started building these relationships, and they still all ask for Marilyn. We have a crisis in New York with the Minority Senate Leader and then the group that broke off from them. Andrea Stewart Cousins, we had a therapist who knew her counsel last year at Lobby Day, and that was terrific because she does have power. That therapist came with her friend, and they got a face-to-face with Senator Stewart Cousins. All these little networking things are extremely important. You never know who knows somebody and can get you in the door. That has helped us tremendously over the years with people. Speaker Silver, when we were trying to get direct access passed, it was his niece who, her Uncle Irving went to the same temple as Shelley Silver. And so this therapist, I think he was a student at the time, got us face-to-face with Speaker Silver, and that was, the beginning of getting direct access passed. Joe Morelli has a good group of Finger Lake therapists. He has been a big opponent or obstacle in getting the copay bill. He just wasn't really helping with moving that bill along, and his constituents wouldn't give up, so then he helped to get a face-to-face meeting with some of the insurance representatives in NYPTA many years ago. Well, he's moved up from being chair of the insurance committee, and now he's majority assembly leader. So it's good that people never gave up with him. They were respectful. They stuck to the facts. Nobody was insulting. Nobody was derogatory, because these people might move right up to the top position. And then Brian Kolb also has a good number of physical therapists who keep in touch with him. So he's the minority assembly leader. He's a Republican assemblyman, but you never know when the parties will change. So your legislator wants to know how they can help you. And that's why you have to know before you go into the meeting what you're going to ask, or if you're there for thanking, or whatever it is, you got to have that in mind, because the meetings are quick. It might be that, well, everybody's going to have a lead participant. That person is going to be who has the packet that you'll take from the third floor, and the constituents are going to make sure they introduce themselves first, saying where they're from. Or if you work in their district, you can use that. If there's other additional students or other therapists that are not constituents, by all means they introduce themselves, but you first want to make sure the constituents are the ones that have their attention. You're going to make sure you dress professionally. You have to have your photo ID ready for the security screeners. You can park, if you're only coming for a couple of visits and it's not a horribly busy day, then you might even be able to park right on State Street between the Capitol and the big legislative office building. And that's like 2-hour max parking, and you pay with your credit card. The parking meters machines, they don't have the meters anymore with coins. You have to go to the machine and then put your tag on your car. Otherwise, you can, if you get there early enough, you can get a spot in the Empire Plaza parking garage, or the garage over by Pepsi Arena or by the New York State Museums. This is all on the NYPTA website. But you just have to realize that you've got to get through security, so you have to have enough time. If it's a busy Tuesday lobby day, there's a long line. You're going to make sure you have that participant packet with you ahead of time. As soon as the chapter sends it, it'll have the memo from Mike Mattia, it'll have the bills, the memos of support, and then additional articles. I set appointments up ahead of time. You register for lobby day, and I set them up keeping in mind when you are going to be there, but sometimes there's last-minute meetings. So when you come to the third floor of the Legislative Office Building, there's a table for Eastern District. You've got to check in and be sure that you get the updated schedule, just in case a room change has occurred or a time has occurred. If you're designated the lead participant, then you've got to get that packet. There's only enough packets for the legislators, because they don't let us store things like they used to in the old days. Before 9/11, we could have boxes of things in one of the assembly members' offices. Now they just let the staff bring in things that very morning. So it got too hard to have participant packets as well as legislator packets. So you're going to download yours, and then the participant packets are, the legislative packets are only for the legislators. There'll be a name tag for you. If you're not familiar with the Empire Plaza, the 9-story legislative office building is called the LOB. The Capitol is denoted by CAP. If you have a meeting with Senator Breslin, he's in the Capitol. So if you go outside between the LOB and the Capitol across the street, you've got to go through security again. You can do that, but just leave yourself enough time. Otherwise, there's a tunnel between the Legislative Office Building and the Capitol, and you can stay inside and you don't have to go through security again. You got to make sure you plan to arrive early, because if it's crowded, even with elevators, take the stairs, because you don't want to be late for your meeting. Another group might be waiting, and they might be taken in, and you'll lose your space. I think that's a repeat. If you have business cards, bring your business card. I think the packet has the business card for NYPTA also. So if you don't have one, then NYPTA's card will be in there. But if you do have one, that would be good to give, leave them your information. Okay. These people are nice, friendly in Eastern District. They most importantly, they want to just have the 15 minutes with you. If there's an issue that they do want to be educated on, just remember to use layman's terms and try and give the examples of how it impacts the patients. Or if you're, I relay the small business that I have, and that it truly has made a difference in how we have to deliver our services now, because patients sometimes don't even tell us they're not going to come because of the copay, and then they make an appointment and cancel at the last minute. So I'll talk about the efficiency of a business and how the high copay bill has affected that. Mostly I talk about how it hurts the patients because some of them don't follow the post-op protocol and end up having complications because of the burden the insurance companies have imposed. So deliver the message in the summary of how they'll best understand how it affects patients and our profession. You're going to make sure NYPTA supplies us with thank yous. So before you leave, you're going to write a thank you. If you have enough time, get the legislator, ask them if you can take a picture together. They love that too. They'll post it on their Facebook as well. And you're going to be sure and follow up. If they requested additional information and you didn't have any answers, then you're going to make sure you put that on the summary form and return it right to the desk there before you go. If you've got time, it really is best to fill it out before you leave for the day, because sometimes it gets put in the things to do pile. And the NYPTA compiles all of the information on who supports, who signed on as a co-sponsor. So the lobbyists will look at that and it will help them to formulate what meetings they should do. And that's about it from me. So how do I go now, Gloria?
Are there any, are you going to ask if there's any questions? I can see there's only really one in the queue at this point.
Yep, so if anybody has questions at this point, if you can start typing them in. As you've seen, both just with our presenters, they're tremendous resources, very knowledgeable. They will have wonderful answers, I'm sure, to give you guys. But thank you both again, both Jake and Doreen. You guys were wonderful to listen to. I'm so impressed. I guess, Doreen, I really liked the question that you put out as an example. So can you comment on that one as to whether or not PTs will be opposed to any bills this calendar year?
Yeah, I did ask that because I didn't know the answer. So, Jake, I had put on for Lobby Day, will we be commenting on the athletic trainer licensure bill?
I think it depends on where we're at that time. One thing that I think we're cognizant of is that it sets a little bit of a different tone for a meeting when you're speaking negatively toward another profession and things that they're trying to accomplish. We always try to have our meetings be as positive as possible, but at the same time, we need to protect our interests and make sure that the concerns of the PT are well understood. So there's a meeting coming up in Albany between the Athletic Training Association and NYPTA will be represented, and we'll have again the lobbying staff there, along with probably the chiropractors and the occupational therapists and the medical society, and we'll see if we can get to a point where we can find agreeable language. The current stance of the association is not against the idea of licensure for the athletic trainers. Our big concern is the language that they're using in their proposed bill to achieve that and set their scope of practice. It's just, it's not delineated enough as far as the things that are appropriate and not appropriate for an athletic trainer to be doing, and it's too open. It's too wide open at this point for the association really to be comfortable with. So I think if we can voice those concerns and have a productive meeting with this sort of roundtable discussion that'll be mediated by the offices of the sponsoring, of the bill sponsor, so in this case Senator Funke, I believe, and we'll go from there. So if we get to a point where we still feel like what is being presented in the athletic training bill is really goes against what we're looking for with it, then that may very well become a talking point at Lobby Day. If we can get to a point where it seems like we're on good terms, then it may not. So I guess that was really a long way of saying I'm not sure yet.
Jake, can you comment when that meeting is?
It hasn't been scheduled yet, but you know, the athletic trainers are really looking to get this done, and I think that their bill sponsor would also like to have this off of his plate. So I think there'll be some motivation to be done with it after this session. But as far as we're concerned, really not. We are heavily committed to not being supportive of any movement until we can clear up some of the things that we're having issues with.
Okay,
That meeting
So
will be within the next month, I would imagine.
So before Lobby Day?
Yeah, it should occur before Lobby Day.
Okay. So we had a couple other comments, questions come in about taking time to spend with our legislators outside of just Lobby Day. So are you looking for some of our PTs to pursue setting up individual home office meetings?
That is always welcome. This is Doreen. That's always welcome. And if people don't feel comfortable going alone, then I'm happy to accompany you, or to see if someone, another constituent in your district whose experience would be able to accompany you. We did have several. Tracy Sawyer was one of them last year who went to home visits. I went to home visits. As I mentioned, Tom Cooney had invited Assemblyman Tedisco, and I think we saw the others in, some of them don't even have a home district office. They just use the Capitol. So I think we went over to Assemblyman McDonald as well. So yes, if anybody wanted to, and that's where I reach out to the Plattsburgh people, because they tend to not travel to Albany, so they visited in Plattsburgh. If you'd like to do that, then contact me, and I'll help you set that up if you want help with that.
Okay, and to that point,
I'm just going to add one thing to that, if I can.
Sure.
I think another option. It's always great to go to their district offices more locally. If anyone is interested, another very powerful way to have a really great meeting is to invite a legislator to your clinic or rehab floor or whatever setting that you work in. We found in the past that one, the legislators really like being out there and being seen by some of their constituents, and two, when you're setting up that meeting, if it's you've got a couple of patients who live in so-and-so's district and they're going to be there for therapy during that time, that is really just a wonderful plug for physical therapy and an opportunity for that individual to make a connection with their legislator, and then also an opportunity for the whole thing to kind of be seen in action.
Awesome. So to kind of tag along to that, one thing that we had, or you had mentioned earlier, was just being careful because of the timeline. So they're working on the budget right now. Can you comment any further on like some other tips, or in terms of scheduling or timeline, time of day, or other strategies that we may have to touch base with our legislators?
They would be in their home offices on Thursdays and Fridays. So when you call their district office, you would see if they were going to be around on Thursday or Friday. Or you could see if they're attending any events in your neighborhood and you might be at that event, or you could go and introduce yourself. Like, as I mentioned, I would see Assemblyman McLaughlin at the East Greenbush softball field for opening day. So I'd try and always make sure I went over and said hello. Same with when Assemblyman Canastrari was my assemblyman. He was everywhere. He was at every parade and every benefit. So I would try and always make sure to say hello there. But if you're going to set up a meeting, it would be on Thursdays and Fridays in their district meeting, in their district office.
And that's something that you would be able to help our members with scheduling, or you'd want them to do it on their own?
Oh, no, I would help them. For sure.
Okay.
Would you like to take some time to do the role play then?
Yeah, that'd be great.
Okay, so Jake is going to be the senator. First, he's going to be a friendly senator. And so I'll be the PT coming in. And so you're always friendly with the secretary or the intern. Sometimes they look like they're only 20 years old, the interns, but you're friendly as soon as you walk in. sometimes they'll ask you to sign in. They'll say, good morning, I'm Doreen Frank with New York Physical Therapy Association. I have a 10 o'clock appointment with Senator McGregor. And they'll say, okay, have a seat. We'll let him know you're here. Or they might say, oh, he got called out to chamber, so you're going to meet with his legislative assistant, whatever. But we'll say it's Senator McGregor. So then the senator, they bring you into the office, or the senator comes to get you. So your cue, Jake.
Okay. Doreen, great to see you. It's been a while since the East Greenbush softball started off.
Yeah, you're always so good to East Greenbush. I seem to see you here and there, and everybody loves you. So thank you for all the services you do for our town. I'm back here again to say thanks. I'm so glad that you added your name to the Stop High Copay for Physical Therapy legislation. I'm sorry that it keeps coming back. We have great support again this year. We've got 21 in the Senate, and we've got great bipartisan support. We've got a great Assembly co-sponsorship with 82. So we're really hopeful that this year might be the year it gets passed. I'm telling you, Senator, it's been so hard on my patients who have $50 and $60 copays, besides their high premiums. I've had to change the way I do practice now because they can't come as often as they are expected. And we've gotten to be very creative because we can't expect them to come in as much as they should. If there's anything you could do to ask the Senate Chair to put this on the agenda, it would truly be very appreciated. I know you've been understanding in the past, and I'm not sure if there's anything that you could tell us that we should change, but any of your help would be appreciated.
Yeah, always happy to help out. What seems to happen when these individuals are not able to get this PT care because they can't afford their copays? What happens to these people?
Pardon me? Say that again?
What happens to these people? What happens to these people when they can't get their PT because their copays are too high?
Well, for example,
what's the downstream effects of that?
For example, a patient who had shoulder surgery, a significant rotator cuff tear, you have to be very careful with that, and they're only allowed for the therapist to lift their arm in different ways, what we call range of motion. They can't do that on their own. We do teach a family member, but sometimes it's very hard to have a family member treat you. Well, if they don't get the proper frequency of treatment, then that post-operative shoulder is going to freeze up. They're going to end up with a frozen shoulder. They're going to end up going back in under anesthesia for a manipulation of the shoulder. It's going to cost the insurance company more money and certainly the discomfort for the patient. So, there are people who will, financially be able to invest in that, but there's too many people with low-paying jobs and, families to support, as you know, that can't afford that. So that's what's a shame about this, is physical therapy is so cost-effective, and we're the ones that get people back to functioning. We don't want them on addictive pain meds. We don't want unnecessary surgeries. A lot of times people even have unnecessary MRIs because they haven't gotten better. Say they had low back pain. Well, it's in the research. MRIs aren't really indicated for most low back pain patients. But if they can't receive their physical therapy and have pain relief, they go back to the doctor and say, I'm no better. And the doctor says, okay, we'll get authorization for an MRI. A lot of money. So it's been a vicious cycle.
It sounds like it. Well, I'm happy to reach out to some colleagues and see if we can get this thing moving for you a little bit.
That would be great. Another thing that you've signed on to be our co-sponsor has been the bill that would permit my physical therapist assistants to treat the injured worker. You're nice enough to sign on to that. It passed in both the Assembly and the Senate. Unfortunately, I guess a ton of bills were delivered to the governor in the winter, and he vetoed a vast majority of them, which included our workers' comp physical therapist assistant legislation. So we have to reintroduce that again this year, and we're grateful for your support. His veto message was full of inaccuracies blatant falsehoods. I don't think they understood the bill, so we'll try and educate the governor's office again, and hopefully we can get this moved through quickly as soon as the budget's done. And I know that you understood each of those issues, so I won't waste your time with that one any longer either. I am here today to also ask if you would please sign on to our educational bill. Many years ago, the physical therapists who graduate now have to earn a doctorate in physical therapy. So we would like our licensure bill to include protection of the DPT. And there's really no, this doesn't impact budget. It's just an amendment for the licensure, our educational bill. So if you could look at that and sign your name onto that, that would be another thing for me to thank you.
Terrific. I can certainly do that. That sounds
I won't
like a
take up any
no-brainer.
more of your time. I'm glad that we have physical therapy has a friend in you, and if there's anything I could ever do for you, please let me know.
Anytime. We'll see you at the softball field.
Okay, thanks again. Okay, now we'll go to one who maybe our new maybe Senator Tedisco wouldn't be such a fan. He probably will be, but we'll pretend he doesn't know anything about the copay bills. So, or maybe I should choose another one, which I don't know who would be opposed to the copay bill. That's the funny thing.
Maybe the workers' comp one with the veto stuff. Maybe we could try that one. We could throw some of the veto things at you.
Okay, so we're doing assembly. Okay, so I go into the office, say I'm Doreen Frank with the New York Physical Therapy Association. I have a 10 o'clock with Assemblyman McGregor. Okay, and then he can bring me into his office and say, "It's nice to meet you, Assemblyman McGregor. I'm Doreen Frank. I have a physical therapy practice and I live in East Greenbush. I'm looking forward to getting to know you."
Hi, Doreen. My daughter's a chiropractor.
Oh, that's a small world, because my husband became a physical therapist and then a chiropractor. So I used to joke with the doctors when they'd say, "Wait a minute, did I just hear your husband's a chiropractor?" And I said, "Yeah, I sleep with a chiropractor." So you know a lot about the musculoskeletal world with chiropractic. I bet you've heard some stories about workers' comp issues from the chiropractic world. I'm here today because we've had success in getting a bill passed that would change the workers' comp ground rules many years ago. Just happened to leave out that a patient could receive care from a physical therapist assistant, just as they receive care from a physician's assistant. A physical therapist supervises a certified physical therapist assistant. So workers' comp said they couldn't change it themselves. It had to be done legislatively. So it passed without any opposition in the Assembly and the Senate. But then when it got to the governor's desk, with a flurry of other bills at the end of last year, apparently the majority of those bills were vetoed by the governor. We were extremely surprised to read the veto message, which had many inaccuracies in it. And so we've reintroduced the bill, and it's our mission to educate the governor and his staff in what the bill really means, and hope we can count on your support and perhaps to sign on to the bill.
Yeah, I remember this one. I don't know why you guys think it's okay for these PT assistants who are not subject to any state oversight to be providing care to our injured workers.
Oh, no, actually the physical therapist assistant is within the sanctions of the Office of Professions. Physical therapist assistant is certified in New York State. It's not on the job. They have a 2-year degree. They're under the supervision of a physical therapist. They do not perform evaluations or discharge evaluations. If they're going to change treatment, they must consult with the physical therapist first. And in my setting, in the private practice, a physical therapist has to be on site with a physical therapist assistant. They're not left in the office without a physical therapist. So there's great oversight of physical therapist assistants, and they've every other insurance company, including Medicare, permits treatment by the physical therapist assistant. It is only New York State Workers' Comp that doesn't. Even No Fault, which uses the ground rules, the payment system, they permit treatment by physical therapist assistants. So it's just like I mentioned, the physician's assistant treats those patients that a physician treats. It's the same kind of situation for physical therapy. It doesn't affect the payment at all. The payment is the same because, unfortunately, New York State has a cap on each treatment. So in our neck of the woods, you get $47.28. It's not like they're paying any extra money, so it wouldn't affect the payment. Well, I think that physical therapist assistants are losing job opportunities because physical therapists won't be hiring them if they're not going to be permitted to treat injured workers. So that will affect our employment in our district. I truly think that's so. Physical therapist assistant schools have already closed. Maria used to have a program and that closed. So I think that it's really wise to get this bill passed, and that's why our association will work hard to educate the governor's office. Do you have any additional questions about this bill?
No, but I do appreciate you educating me on this apparently complicated issue that goes beyond what I just remember reading from the governor's veto message.
Yeah, I mean, in my office, I have physical therapist assistants that have been with me for 20 years, and some patients would be so disappointed if they couldn't have treatment with them. One that came who was, regular Medicare, had treatment, and then he had a work injury, and when he came back in, he asked to be seen by Jen, and we had to say, oh, I'm sorry, you can't because the workers' comp carrier won't allow it. He couldn't believe it. So if you think about it and you would blue slip the bill, that would be great. I really would appreciate it. And if there's something, additional information you need, then I'll provide that for you. Well, thanks for your time today.
Thanks so much.
Okay, so the
coming
blue
out.
slip is a reference to the paper that they have to fill out to add themselves on as a co-sponsor, because sometimes they'll say, yeah, okay, I'll blue slip that. That's what that means. But, you're just going to be polite, and they make it easy. Our Eastern District people are really very easy. I'm sure the two new people will be easy too. And you won't be alone if you haven't ever gone to Lobby Day. You'll always be with somebody. Even if that person isn't the constituent, they'll kind of lead you in, and then you can participate with the conversation. So it's a well-oiled machine now. It goes very smoothly. Anybody think of any other questions?
I have not seen any other questions come in. We did have one comment, just a big thank you for all the work that both of you do, helping to prepare us and also helping to further our profession within the legislation. So thank you so much. I know you both work so hard, both for the district, Doreen, and Jake, just for what you do for chapter. It means a lot to us, and just being able to learn from both of you.
Well, it's our honor. Okay, is that a wrap?
I think so. We haven't had any other questions come in, so that's okay. But thank you, everybody, for attending. If you do think of something else that you wanted to ask, my email came into the GoToMeeting message that you received after you registered. So feel free to email me. I know how to get in touch with both Doreen and Jake. They've been very responsive and super helpful as we've been preparing these pieces, and I'm happy to get in touch with them. And like Doreen said, if anybody in Eastern would like to set up a time to meet with their legislator, either doing a home visit or if they have any questions related to Lobby Day, Doreen really, as you can see, is super knowledgeable. She would be more than happy to help you. And I'm looking forward to it. I certainly plan on signing up and doing it this year, so you guys will see me. But
Terrific.
Thank you again both so much.
Okay, have a great night.